It's quite exciting for me to be here, and I'm quite honoured to be here, so thank you to all the institutions involved, because I spend quite a bit of time talking to oncologists and clinicians about cancer. It's nice to actually talk about the fleshy bit around the tumour for a change. And this is where we've come over the last few years, and that's really, really important, because I almost felt like I was known as Mr. T3A-NOMO for a while, and I'm actually called Mark. So I was wondering where to start today, and I figured the beginning probably is the best place, and so we'll see how it goes. You know, I never thought the first time I'd be on stage I'd be talking about my backside, but there we go. I was 31, living in London. I owned a sales company. Life, as you can tell, was pretty good. I didn't particularly look after myself, but I was 31, I didn't really care. And I literally had no idea I was ill. And people say to you, what's the scariest thing about cancer? And the scariest thing about cancer was the fact I didn't know I had cancer. I don't know if I was just oblivious to the symptoms, but they crept up on me. Now I had rectal cancer, bowel cancer. And like I said, I had T3A-NOMO tumour. It's about 5 centimetres across. And I had a few tests that I didn't really think about. For the clinical professionals in the room, I believe speaking plain English is very important when talking to your patients. So please explain to them that a digital examination isn't a high-tech thing. That was a shock. I think she was related to E.T. or something like that. However, after the CTs and colonoscopies, I was told that I had a adenocarcinoma of the rectum. And I went, you got cancer, Mr. Davis. Now, unlike the advert, I didn't sort of go into slow-mo and collapse and people catch me. I owned a sales company, so we all deal with it different ways. I was a bit more bottom corner, to be honest with you, because I wanted to go from having to not having. And I think that's an important part of this conference. The cancer itself didn't worry me. I wanted to live. So my focus straight went on to, right, what do we do about it? And he said, come back in 2 days. So I came back into, have we got any surgeons in the room? Sorry for what I'm about to do. I went back to the consultant, and he said, okay, here's the deal. Your tumour is too close to the rectum. That's the best I could come up with on Google Images. They didn't have a picture of the tumour and the sphincter, so there we go for the golfers. And because it was too close to the hole, they said they got to remove everything. They said, 50 years ago we invented an operation, we're going to cut you open, remove your anus. I'm not sure why they did the hand thing, I thought that was overkill. And we're going to give you a bag for life. I said, like, wicked. They said, it's called an APR resection. And I was like, right, so what's plan B? Because 50 years ago, we put men on the moon. And he goes, no, that's it. And I'm like, okay. So if I do nothing, what are my options? He says, well, you've got about 12 months to live because I had a T3 tumour. So let me get this right. My options were a bag for life, other varieties are available, or I'm dead. He goes, yes. I went, excellent. I went to the pub. It's relevant if you know South Park. I'm out of here. I went to the pub and discovered Stella, which I think should be put on the NHS as a post-trauma treatment option. But that's just a personal opinion. And then I went and looked around because I didn't like my options. And all joking aside, this is where survivorship started for me. I remember having a conversation with someone from Macmillan about 4 or 5 years ago about survivorship, and I said, when does it start? And they said, after treatment. And I said, well, actually, from my point of view, it started 2 seconds after diagnosis, because that's when I wanted to live. That's when I was told I was going to die if I didn't do something about it. My big concern was I was told I had to have a bag or I had to have a stoma. Or I was going to die. And this is 10 years ago, so things have improved a lot. But I was not really given any time to digest this. I was given more time last night to decide whether I wanted to have the smoked mackerel or the asparagus as a starter than the most important decision of my life. Bag, die, Stella. Stella obviously won. I didn't have another treatment, but I ended up very luckily finding a treatment up in the northwest. I was living in London at the time. For those of you who know Clatterbridge, Professor Mint over at Clatterbridge, I discovered a treatment called Papillon, which is a brachytherapy treatment. And that worked out really well. And the big thing for me was fear. My fear of the treatment was scarier than the cancer. And that molded where I was going and why I'm still here now and to what state. Because my pathway started on that day. And I think survivorship is very, very important, as we've just heard. But it's more the living with and beyond, as we now call it. Because, as you blatantly saw with Joss and Carol, it doesn't start after the end of treatment, because for some people, there is no end of treatment. And so your pathway can be determined very much about those decisions in the early days and the information that you're giving during those early days. And I think this is important, and things have worked out a lot better and things are improving. But again, it depends on the cancer you have and the doctor you have and the specialist you have. I always say to people that, the GP saved my life, because when I went in complaining after a Singapore noodles that I had stomachache, she took me seriously. Professor Mint saved my backside. But it was the staff, the nurses, the radiographers, the registrars, and all the people on the ground who saved my sanity. And they helped me through the journey. And my journey didn't stop at cancer. Whatever the decision I had to make, and whatever decision anyone makes, you've got to live with the outcome. My choice then would mean I either have to have stomach care for the rest of my life, or I had quite a lot of radiotherapy. So there are some side effects to that. But surviving cancer isn't just it's gone now thing. And this is something that I had to learn. I got lost. As Carol mentioned it, I got lost. When I had cancer, I knew I'm a cancer patient. What am I once you've removed the tumour? Because at the time, I was given some fibrogel, like I needed it, and some codeine, and that was it. There you go. You've had microsurgery. We've removed the tissue. There's no cancer cells. You've still got your bum. Cheers. See you later. Macmillan Nurse came in at that point and again saved my sanity, because she just listened to me, and that was really important. Didn't judge what I was saying, and that helped me move on. And there's all these things here are what Macmillan and the Christie and Salford are looking at. Not the physical, just the physiological effects of having cancer. And I think it's important as we move through in terms of society as a whole, because doesn't he look like the BFG? This is a chap who was treated with Papillon over at Clatterbridge. He was 99 years old when we treated him. He got his letter from the Queen when he turned 100. He brought it in for us, which was very nice. And he was like, that's Professor Mint. He said, Professor Mint, she hasn't signed it herself. And that's tantamount to the fact that society is getting older. When she started off signing these, it was done by hand. Now it's digital. Well, you old people are just hanging around. It's a nightmare. My mum's just come back from backpacking through Thailand, and she's 70. That's where I get it from. Education is really important, which is why I'm glad I got here. But it's not, funnily enough, education just from the patient's point of view. It's you guys. Because I jokingly say to bowel cancer screening nurses when I lecture over at John Moores, say the only people who don't use Google are surgeons. But there is a big concern that patients, if they don't like what you're telling them, at any point will go and find alternatives. And I know, because I've been a buddy for a while, that people have gone off to hug trees and stroke beavers in Canada because they think that will save them. And if that's their choice, that's fine. They should be allowed to do that. But I don't want people to be more scared of the choice that they're making and the potential life they're going to lead after the cancer's gone. This is why the MDT is really important, but there's no point everyone sitting around in discussion, the patient still being told what they've got to do. I think it should be a discussion, but it's very difficult. I'm in radiotherapy now. I work with radiotherapy equipment, so I know quite a lot, but I still get confused when I listen to most of the oncologists and surgeons speak. The work that Macmillan and Christie are doing with patients is hugely important because it gives us our voice, which is great. Because sometimes it does feel like I'm shouting in a vacuum. I don't mean a Hoover, obviously, I mean a vacuum. And no one's talking. Or as they say in White Man Can't Jump, you know, you can hear Hendrix, but you're not, you know, you can listen to Hendrix, but you're not hearing it. And this is how I felt for a long time, saying the same thing, but no one was listening, just going, yeah, patient. What do they know? Well, you know, quite a lot, because we were there when it happened. This is why, great book available on Amazon, I wrote this book, because surviving cancer was a journey for me. 4 years after having cancer, I suddenly realized that I'd had cancer. It hit me. I was different. I didn't know how I was different. The grass wasn't greener, the sky wasn't the bluer, the landlord didn't care. He wanted his rent. And I just knew I was different, but I didn't know where I fit in life, in the world, and did what anyone would do and went backpacking around Thailand, as you do. But I realized that I'd been lying for 4 years because I was trying to be happy all the time and laughing it off, having cancer, because I didn't want my mum to worry, or my girlfriend at the time, or people like that. So I hadn't actually dealt with the cancer. I just had a discussion a second ago. What I see about cancer now, 10 years on, is a lot different than I saw during my treatment and 10 weeks after treatment. And it does remind me of one of the astronauts said on their trip to the moon. They said it freaked them out a little bit because they could cover the Earth with their thumb. The Earth, that while we're on it, it's the biggest thing in the world, literally. But from the moon, from being further away, it could be covered by the thumb. And that's kind of how I feel. I can see things a little bit clearer now. Maybe not in a more sane way, but I can see them a little bit clearer now. So that's really my story. The survival pathway for me started with cancer, but is ongoing. And that's great. It means I get to stand up in front of a load of strangers and talk about my bum, which is a bit weird. But if I can help in any way, that's great. But I just want patients to be listened to. And I think the stuff that we're doing at the Christie and Salford and Macmillan is really, really important. Because once the tumour's removed, there is still a person there. And people do die. I'm burying a friend today up in Blackburn who died of a brain tumour. He was 36. So people do die. But all those people who don't die want to live. And that quality of life is really, really important. So as soon as this is a survivorship conference, I will leave you with the immortal live long and prosper. Thank you very much.
Fantastic.